Hey everyone, my name is Rich. I am the founder of Medical Referral Hub. With me today, or with us, myself and my co-host, Dr. Marlene Hurd Allen, PhD, we have Dr. Victor R. Bruce of Las Vegas, Nevada. Dr. Bruce came out in 1998 after he finished a double residency on the East Coast. So, Dr. Bruce, please introduce yourself to our audience.
Hello, everybody. Yes, my name is first name is Victor. I have an African name, Aite. Last name is Bruce. I was born in Ghana, West Africa, where I did all my education and my medical schooling till I came out to the U.S. to specialize. As I would like to share with you, I was 19, just getting into first year of college when my mother unfortunately she passed very suddenly, and the reason she passed was that she had these boils at the back of her neck. She was a little overweight, and you listen to people around you and they say, hey, just put some herbs on it. Next thing we know, she had meningitis. She was dead, right? um, that really hit me in the gut because now I had to survive by myself somehow, some way. That drove me to research and go into the field of medicine because, come to find out, when I got more knowledgeable, the thing that kills us so suddenly was ignorance. Because basically, if I see an overweight adult with a carbuncle on their nape, that's type 2 diabetes until proven otherwise. So it would have been as simple as an incision and drainage, some antibiotics, test their blood sugar, bring it down, and she may be alive today. Wow. Anyway, so that drove me to be highly motivated to educate people about health and wellness and really make it the number one. When you consider what is wealth, I believe health is number one. Otherwise, nothing else counts.
Wow, that's a powerful testimony, and you're here out of unfortunate, tragic situation. But we are definitely glad that you chose to pick up medicine and help people in your community, and now definitely around the world with this video. So, Dr. Bruce, now you're gonna have to explain this one to me. I found your business card, well, actually your flyer, which is great marketing, by the way. I found it at a local business here in Las Vegas, and I was really impressed by the amount of things that you have listed on this card that you're specializing in. And for the people at home, IV therapy, personal injury evaluations, general physicals, physician guided weight loss and wellness programs, home, office, hotel visits, and you're specializing in diabetes, asthma, high cholesterol, heart disease, female health, and mental health challenges. Dr. Bruce, how are you managing all of this?
Well, to start off, like I explained to you, I got very lucky to train in a program where I did pediatrics, which includes adolescent medicine. Mm-hmm. So that stops at age 18, right? And then from 18 and up, you go to an internist or internal medicine doctor. Well, I trained in that as well.
Okay.
So I'm able to handle the whole gamut of conditions, and as well as my main focus is on wellness medicine now, because for years, I practiced it breaks, you fix it kind of medicine, right? And after a decade or so, I started thinking, am I really making a long-lasting difference in people's lives? Why wait till they show up to you with a stroke, when you could have caught them early and found out that they had high cholesterol and high blood sugar and high blood pressure. Mm-hmm. So I started asking, how can I do more of the wellness type of medicine where I actually see people and prevent them from getting sick?
Anyway, I like that. It's almost preventative medicine.
Yes,
Let's
yes,
not
yes.
wait until the person is already too far, too far gone to where they
Yeah.
have to be admitted to the hospital or, something of that sort. But,
Correct.
as it states on the card, the general physicals
Yeah.
are what people are going to need to come in and check in with you and, make
Correct.
sure their levels are good and their labs are normal. So
Right.
that's really cool.
He's actually saying prevent an unnecessary emergency room visit.
Yep.
Correct. And what happens, sadly, I don't know why it's designed that way. The most dangerous conditions that cause a lot of problems are typically asymptomatic. So it's really hard for me. Like if you go to a dialysis center, you're going to find a good 70% of people with bad kidneys are Black folks, because there's a lot of undiagnosed and untreated hypertension. Why? It doesn't hurt. I see people coming all the time. I encourage them to come for a physical, and they walk in and the blood pressure is 180 over 110 and they feel fine. I'm like, why is it not like a toothache? You would immediately, so we have to be really proactive in getting people in, checking their blood sugar. Again, you can walk around with blood sugar of 250 all day. You might pee a little bit, maybe a little tired, but little by little, it's clogging your heart, because the biggest killer in diabetes, it's actually heart disease. A lot of people don't know that. It's clogging the small vessels in your heart. It's causing damage to your kidneys, to your eyes, and of course, the end results, you're gonna get amputations and all that. So I'm very big on preventative medicine. Also, doing the weight loss. Of course, the typical American diet is quite horrible, and the food, the big boys in the food industry make sure we keep eating bad.
Yeah.
So instead of waiting till you hit 300 pounds, I catch patients and I use natural methods that help them to achieve optimal weight. I teach them about proper eating. And I never recommend go on a diet, because nobody over the years can keep any diet. I don't care if it's Atkins or keto or whatever, you get bored quick. You want to implement a lifestyle modification that you can keep forever, and do everything in moderation. So I tell my patients, if it's white, don't bite. Eat the colors of the rainbow. Everybody understands that, Eat the colors of the rainbow means, your plate has some salad that's green, some tomatoes that's red, and so on and so forth. And if it's white, everybody understands it's potatoes and, rice.
Hold on, wait. You're telling me I gotta give up the potatoes now?
Well,
I love baked potatoes.
And I don't tell.
He didn't say that.
I don't tell them to give it up. I tell them if you're gonna eat it, it should be no more than the size of your, the palm of your hand.
Okay.
But the majority of that plate should be the greens and the veggies and fish and all that. And so when you give people guidelines that don't sound like punishment, they can maintain it. Also, I use a compounded series of injections that has mainly vitamins, vitamin C, B12, B6, and there's some essential amino acids. One of them, they call methionine, inositol, choline. They all help to stimulate your fat metabolism and have your liver be able to clear fat that has been metabolized, give you a good amount of energy. And so we use these, and none of these are drugs. They're all natural ingredients that none of us get quite a good amount of. So I use that plus modest exercise to get people to lose weight and stay committed. That way, when you come to me and you're on 3-4 medications, I give you a goal. Okay, by Christmas, I want to be able to taper down your cholesterol medication or your diabetes medication and have you control it with lifestyle modification alone.
Nice.
And I give them goals that are achievable, 1 to 2 pounds a week. You know why? Because the commercialization of weight loss, where they say lose 20 pounds in 2 weeks, it's terrible because your body is going to think you're starving and it's going to lower your basal metabolic rate. And 2 years from now, you're going to be bigger than before you went on that crash program. So if you lose it really slowly, your body does not detect that you're shedding that pound a week, 2 pounds a week. And so I give them goals that are achievable. I'm like, look, you need to lose 100 pounds. 100 divided by 2 is 50. We have 12 months to get there. People can deal with that. And so I do that. So I use a lot of the IV therapies, mostly for nutrient supplementation, because there's several, vitamins and amino acids that we can never get adequate amounts in food. And most people don't even drink the right amount of water per day. You're supposed to drink, we say what, half your body weight in ounces. So I'm 200 pounds. I have to drink 100 ounces of water a day, right? Which means we're talking, maybe 8 of these. How many of us are able to do that? We're not. So I get people coming, they have chronic fatigue, they work a lot, they don't eat right. I bring them in and I do, IV hydration with, there's one popular one called Myers cocktail. It has, a good amount of vitamins and minerals and calcium and magnesium, and they bounce right back. And, sometimes I might have somebody who's elderly or too frail, they don't have transportation. I do go to their homes and hydrate them as well. So I have a private practice, and I harness technology to the maximum ability. So my electronic system, I'm able to do telemedicine visits. I'm able to, whether I have a laptop or my phone or an iPad, anywhere there's internet, I can get into a patient's chart. Everybody has a picture of the patient in the system, so when I pull up a name, I see the photo, I'm like, oh yeah, that is Mrs. Hurd, everybody's, because of the technology, I'm able to see what are you allergic to right there. In the old days, if you get a call on a Saturday and you're in Walmart and somebody has a sore throat, you pick up the phone and you call their pharmacy and you call in Augmentin for them. And then Monday you come to the office and you see
they're allergic to
penicillin. And you didn't know, and you had no way of knowing because you're not in the office to look in the chart. With technology, if I pull up their name, their allergy pops up in red. I know they're allergic to penicillin. I don't have to make a phone call. I just get back on my phone or my iPad and I'm sending a prescription for Z-Pak or erythromycin electronically. It's gone. I go do my shopping. So technology allows me to be about 3 doctors in one. I save a lot of time. I'm efficient, and I'm able to give each patient a good amount of attention, listen to them, not talk down to them. I make sure you understand what I'm explaining and tell it back to me. And I make sure you don't have any other questions that are unanswered before you leave when I see you. So I do a lot of stuff.
What does all your IV therapy cover?
Yeah, I do not do TPN and anti-infectives or chemo, so I refer those out. So I do really the what I call enhancement medicine, the well stuff, because I'm basically office-based and some of us need like infusion centers and hospitals. I don't go to the hospitals anymore.
Okay, so actually now you're like just like you said, you're doing preventative. So I want to get you here, get this going so that you don't have to end up in the hospital.
Correct.
Okay.
And in this day and age of COVID-19,
Yeah.
it has become very, very useful because by the time that virus is done with you, people are fatigued, they're depleted, they ache all over. They can't do half what they used to do. So now they are not able to go to work. Now their family is suffering because it affects everybody. So if I bring you in, and I have a couple of other, IV therapies, for example, glutathione is a body's most powerful antioxidant. We get a little bit of it in food, but again, not enough. So I can bring the person in who's just recovering from COVID and give them IV glutathione. It's just a push. It takes 10 minutes. There's other supplements, all natural, that do. And within a week or two, their energy is back, the aches and pains are gone, they're back to work, and everybody's happy. So I actually love seeing that, and it brings me a lot of joy when they walk in, can't breathe with the oxygen tank, and then in 2 weeks they bounce back and they're going to work. That's where I get my kicks from.
So for your IV therapies, are these all for peripheral lines, or do you have to use some midlines and some central lines?
These are all peripheral lines.
All peripherals.
Yeah.
Okay.
Yeah.
And that's for our audience, peripheral line, that's just a short IV catheter, usually no longer than 1 inch or 1.5 inches max. Put it in right there, get the treatment, you take it right back out.
Right. It's in your arm, elbow, or your hand, or wherever there's a vein, but we don't go into the neck or central. So people who are health nuts and want to remain that way, they are my favorite kind of patient because they are involved. They participate in their own care. We talk about how they're eating, how they exercise, how they handle stress. Make sure, I encourage people to do yoga, do meditation. As a matter of fact, where I believe you found my postcards at the stretch zone.
Yep.
People don't stretch enough. And personally, I have what I call the self-care program for me, and it involves exercise in the gym before I come to work. It involves going to get stretched by professionals. They harness you. I don't know if you've tried it.
I've heard of it.
You did, right?
Yeah.
And then, massages are very good as well. It doesn't have to be expensive. Just basically take care of yourself, like you take your car for servicing every miles. But I see so many people who get caught up in, hustling to make a buck and forget about making themselves number one.
I'm like, I have to jump in on that one. So there's been this trend, or I don't want to say trend, but this glorification of working multiple jobs, only sleeping 3 hours a day, no sleep, let's go, let's get the money.
Right.
But what you just said kind of enforces the fact that you can do that, but the long-term effects of that, like you're going to feel that, in a couple of years, or for some people, maybe even in a couple of months.
Correct. It's
all doctor's orders, stretches, massages, relaxing, right?
Yeah.
Get your work done, but
a little meditation.
I like that one. Yeah.
Treat your body better than you treat your car.
That's correct. And that way, when the wealth comes, you can enjoy it.
You can enjoy it.
Somebody surely is going to spend it for you.
Absolutely.
Happily too.
True. That is true. So Dr. Bruce.
Yes.
You just mentioned that about the meditation and the yoga and all that stuff. So now mental health, recently that's been very in a sense, popular in the media and beyond. You know, we saw things with the athletes and stuff with mental issue. Now, do you notice like a difference in age group that you probably see the mental issues, or it's just generalized across the border?
Most definitely in the most recent several months, that there's a clear age group increase of depression in the elderly, mostly from the isolation that COVID brought to them.
Okay.
And the lack of, social interaction, which we all need. And of course, the other extreme is the young adults with anxiety, a lot of anxiety attacks.
Gotcha.
Pretty much, again, because of the uncertainties of the times with the COVID-19 situation. Of course, they're stuck on the computer, doing all the social media stuff that, has been very topical lately with, teenage girls suffering from body image issues because their Instagram, what do you call it when they make it look prettier than they are?
The filters.
The filters. They spend hours and hours on that. And of course, the millennials with the job losses and lack of financial stability. So there's definitely a spike in anxiety disorders.
Yeah.
Mostly in the younger folks, also in the older, but depression. And of course, you have to be alert to, suicidal. Before, when I was in med school, we never screened people for suicidal ideation.
Right.
But now you have to, as a matter of routine, and make sure you get them the appropriate help, whether it's counseling or biofeedback. Sometimes they have to go to a psychiatrist.
So pretty much it's out there in almost every age range, but different issues in one particular group.
Correct.
Yeah.
Correct.
I got that. Now we spoke about you talked about the hypertension and the overweight, and one of the things I'm wondering is that, like you said, if you have a toothache, you would go after it right away because you feel the pain. But with the hypertension or the diabetic silent symptoms, would you probably see that people are less compliant in seeking care, or because these are considered like you say, common ailments? It's not like the big C. So, I need to go see the specialist. Do you see that in your?
Over the years, what I've seen is not so much because it's common. It's so much because it has no symptoms. So I'll have a patient who, comes regularly. We check their diabetes. We're doing their A1Cs every 3 months. And then maybe they lose their job, right? And then they lose their insurance. And the first thing that goes is that they stop coming to check on that diabetes, and focus on paying the rent and keeping the car going. So it's simply not prioritized because it doesn't hurt. And then 6 months later, when they get a new job and insurance, they come back, and on the A1C that we got all the way down below 7% is 11%. But now their kidneys are failing. So it's I think the biggest issue is it's asymptomatic. And so to prioritize it is tough. That's how it is, because if the same situation happened, and let's say they had a big flare-up of eczema and they're itching and they can't sleep, they will find a way to come in and seek help, and so that's what happens. Is something asymptomatic, they put it on the back.
Out of sight, out of mind. If it's not affecting me in this
moment.
Correct. I'll give you another example in kids. If a kid has severe ADHD, you can't leave them with your friend, you can't leave them at daycare, you can't take them to the movies because they're very disruptive. So the parent will come and get treatment so that the kid getting A's at D's can now get A's because they can focus. Now compare that to the kid that maybe has elevated cholesterol. if it's 240 because
Mhm.
it's familial,
Yeah.
and I check it and I freak, I'm like, geez, you're only 14 and your cholesterol is 240. Well, if I treat it and it goes to 130, they don't feel any different.
Mhm.
Whereas
Right.
the kid who has the severe ADHD,
ADHD. Yeah.
the parent comes back and they're like, oh, thank you, Jesus. The kid
Yeah.
can focus. You can leave them at their friend's house. You don't get 1,000 calls. You can take them to church. They don't disrupt. So it's more about how does it affect your quality of life. I think that's the crux, which is why education is big.
Mhm.
You took the word education. Yes, we do have to educate the community.
Education. So you guys are doing an amazing job that, hey, especially if you come from a family. I am 56 now. I take good care of myself, but at 38, I developed hypertension. My blood pressure was high. I was getting headaches. I was lucky, but I check it all the time. Like, how did I get high blood pressure at 38? Because of the genes, right? You cannot pick your parents or your grandparents or your great-grandparents.
Right.
And sometimes people say, well, but I don't know anybody in my family with them. Like, wait, maybe you know 2 or 3 generations, but do you know 5 generations back?
Exactly. And I do say that.
These genes are passed down, and there's certain genes that we say, there's a phrase, they travel on the same train. So hypertension, diabetes, high cholesterol, gout, many of these travel on the same train. So when I see one with the other, I'm gonna look for the others. And a lot of times it's through the screening and the checkups that you pick these up.
So Dr. Bruce, we appreciate you in your time this morning. We hope that our audience is able to get some great value. And I truly believe we'll be speaking with you again soon.
Fantastic.
I think so too.
Well, have a great rest of your day.
Have a good one.
Too.